CPC 2016, sticking with the theme, make your vote count. Alright, so we're going to have a debate between our two candidates that are going on right now in our general election, but they're going to debate a different issue. They're going to debate the issue of our patient, right? So it's a 54-year-old male. We've discussed this at length about what his lab abnormalities were when he came in. The rest of his CMP showed a total protein of 14.2 and low albumin, so a high protein gap. And his images, we talked about the chest x-ray. There was actually a little bit of a low side of QTC, which you can see with the hypercalcemia. And then they got a chest CT, which showed this sternal mass, as well as a large lytic lesion in the posterior sixth rib. And also, it showed these large lytic lesions in the spine at T4-5 and T11. So, the ED course, the patient got morphine, fluids, Foley for the renal failure, CT chest and abdomen without contrast because of the renal insufficiency. Urine protein electrolytes were sent. And on day 1 of admission, they got a SPEP, a UPEP, serum and urine free light chains, and a bone marrow biopsy. Does that sound familiar to anyone? Yeah, so it was multiple myeloma with presumed plasma. You can biopsy either the plasmatized stroma or the bone marrow. So this person's bone marrow had greater than 90% plasma cells. Parathyroid hormone was normal. They got a uric acid, which was elevated. They got an MRI of the entire spine, which showed cord compression at both of the compression fractures in the T-spine. And they got a skeletal survey. They got a bunch of consults, hematology, radiation oncology, renal, neurosurgery, and ortho, all got on board. And while in the hospital, they attempted to give zoledronic acid, which is non-formulary. It just shows like ordered, canceled, like classic non-formulary attempt. And then they gave aggressive IV fluids, 3 liters per day, calcitonin, steroids, red blood cells. They started the patient on chemotherapy on hospital day 2, right after the biopsy results came back. Neurosurgery wanted a TLSO brace for the compression fractures, and they started radiation therapy to the spinal lesions. On hospital day 3, the calcium was reduced to less than 10. On hospital day 6, the renal insufficiency essentially resolved. The chemotherapy as an outpatient was changed. The patient was discharged about 2 weeks of hospitalization. And chemotherapy was later changed to a different agent with better response. And they were referred to Mount Sinai for an auto bone marrow transplant. So, let's introduce our candidates, right? So, we are going to debate a few things. We're going to talk about just general aspects of multiple myeloma, what we can do as far as diagnosing this in the emergency room, and the associated emergencies from this. So we have both Mr. Trump and Secretary Clinton on the phone here. They were coming in through my computer that was broken. So we also have some fact checkers. I'm going to be the moderator and the fact checker, so you can see correct, intermediate, and incorrect facts as they answer their questions. So let's first start this off. Secretary Clinton, can you please let us know how you would diagnose this in the emergency room?
I'd like to thank you for the opportunity to discuss this very important issue here today. There is a huge spectrum of disease in plasma cell disorder, and I wanted to focus on the most severe form, which is the multiple myeloma. Beyond this obvious bone marrow biopsy or plasmacytoma showing plasma cell phenomena, the hallmark of this disease is the end organ damage to the kidneys, the red blood cell production, and even the bedrock of our bodies, the bones.
All right, Mr. Trump?
Thank you, Mr. Jarrett, and the student council audience for allowing us the opportunity to talk about this today. This issue is simple. It's the bones. It's all about the bones. The plasma cells in these bones, they're out of control. They can't be controlled. They're eliminating our good, wholesome red blood cells. They're just trying to make a life of themselves in the bone marrow. We can't survive just let this happen. There are bones, there are stones, there are even psychiatric overtones here.
Guys, if I will, I believe this document here is actually hypercalcemia.
Yes, I'm sorry, Ms. Clinton. We will get to that eventually, okay? But let me repeat. How would you diagnose this in the emergency room? Mr. Trump?
This is really hard, Bryan. If I know anything about success, which I do, we can't do this all on our own, just from the emergency room. First, we need to look at all the bones, see if there's more spots. Then we need to send the blood tests. All the blood tests. What we're looking for here are big proteins. Then bad guys, and we need to identify them, label them, get them out, and never let them come back.
Secretary Clinton, would you care to chime in?
Well, I agree, Mr. Trump, but we need to measure the M proteins using electrophoresis to help with this diagnosis. We need to get more people involved. Right here in the emergency room. We need to get the oncology team and the renal team to come and give their recommendations. We need to send blood and urine for free light chains, as these do a lot of damage and are important to track. But most importantly, in this diagnosis, at some point, this person needs a biopsy, either of their bone marrow or one of the plasmacytomas, in order to definitively say that they have this disease.
Okay, thank you very much, you two. So let's move on to one of the major issues in this debate, hypercalcemia. Why is it dangerous? And what can we do about it? Mr. Trump?
Hypercalcemia is the worst. Absolutely the worst. It can kill you. It can make your heart just stop. Right there in its tracks. What do we know about this dangerous enemy? More dangerous than China, I might add. Is that it doesn't matter where it came from or how much it is. It's always bad. What we also know is that, like in this case, multiple myeloma is the most common cause. We need to combat this disease aggressively to keep more of our American people safe.
Thank you very much, Mr. Trump. Secretary Clinton?
As you know, Jarrett, I've done a lot of work over the years on hypercalcemia, and we have made great strides. Unlike my Mr. Trump, I know that all hypercalcemia isn't the same. We have to take into account the proteins. We have to think about how this affects people, how it affects their daily lives. It makes them dehydrated, constipated, nauseous, and can even cause coma. I, unlike my opponent, have a clear plan. We need to get EKGs on all these patients, looking for shortened QCC, J waves, which can be signs of critical hypercalcemia.
Thank you very much, Secretary Clinton. I really appreciate your thoughts, but I want to repeat my question. What can we do about this?
Simple answer, Jarrett. We need to get rid of it. Get it the hell out of here! First, flush it out. Lots of fluid. I give so much fluid that we need to get fluid diuretics. So much fluid, Jarrett. Also, tone it down with calcitonin. Great things. Great things. Steroids can treat multiple myeloma. That. Also, I want to bring up something that Secretary Clinton has been very wishy-washy on. Bisphosphonates. Yeah, bisphosphonates. We need big guns to fight big wars here. Let's invest in our defenses. Send in the zoledronic acid.
Okay, and very strong words from Mr. Trump. Secretary Clinton?
I agree with some of what my opponent just said. First, we really need to hydrate these people, but only until we get to a urine output of 100 to 200 milliliters per hour, not to the point of fluid overload, as Mr. Trump suggests. I do believe in dental clearance before bisphosphonates, as I have clearly stated before, as long-term use can cause jaundice. necrosis.
But just acutely, just saying.
Well, Donald, acutely, if these patients really need aggressive treatment, we can just dialyze them.
Okay, well said, Secretary Clinton. Let's talk about the next issue, renal failure, right? This is a really big issue.
Clearly, being dependent on dialysis or renal replacement therapy is a bad thing that we in this country want to avoid. So now more than ever, we need to take a reasonable approach to this, another serious problem. While clearly we need to hydrate the patient to treat the underlying disease and hypercalcemia, we should use caution with loop diuretics. Unlike my opponent, I see multiple paths forward, like using famotidine as a less nephrotoxic bisphosphonate. Also, we have some great new technology that we should use. High cutoff dialyzers, which have shown some promise in removing the light chains which are contributing to this renal failure.
Okay, and Mr. Trump?
Let me be frank. Can I be frank here? Our patients' kidneys are clearly failing. Like I know. So clearly, these kidneys are weaker than my kidneys. But that's beside the point. We know that these light chains are causing the failure, with maybe the hypercalcemia contributing as well. These are bad things, and we need to fix them. I feel so smart. So smart. Because I just mentioned all the things we need to do. Aggressive foods, steroids, and bisphosphonates. Win. Also, let me just say, I've heard some great things about plasmapheresis. Like I always say, get the hell out of here!
All right, so now that we've heard about these most common emergencies in multiple myeloma, what about other acute emergencies?
When we talk about other problems with multiple myeloma, I think about my spine. I have a great spine, as everyone knows. So I always think about the spine. Gotta be worried about cord infection. From the bone or the soft tissue lesions. Also, they need blood. Give them all the blood. Any old blood will do. They just need the blood. But you have to be careful about infection. The bacteria, especially from China, can really wreak havoc.
Okay, thank you, Mr. Trump. Secretary Clinton?
These patients have a lot of problems, all of which need addressing. Some more urgent than others. I saw a woman with mucosal bleeding loss, hyperviscosity syndrome, that needed a plasma exchange. I've gone out into the communities and talked to people with thrombosis from multiple myeloma, even arterial thrombosis. And of course, we can't forget about the fractures that come along with this disease. And like the people that get this, they need to be repaired.
Okay, so thank you very much. Any
Mr.
words?
Jarrett, I thank you so much for having me here to talk about this very serious condition. And I want to say, best of luck.
Thank
Let's
you.
make America great again.
Oh, okay, thank you, Mr. Trump. Secretary Clinton?
Thank you so much, Mr. Jarrett, and the community of SUNY Downstate for allowing us to discuss these very important topics here today.
Okay, so just a little bit of conclusions from our debate. It was a heated debate, but it's all about the crabs. So when you look at multiple myeloma, you have to look at hypercalcemia, renal insufficiency, anemia, and the boning lesions, and we talked about some of the other complications as well. Thank you so much to Dr. Bryan and Dr. Kernsheimer, and these are my references.